plan is for every adult to get a booster shot 8 months after you got your second shot. It will make you safer and for longer. I know there's some world leaders who say America shouldn't get a third shot until other countries got their first shot. I disagree. We can take care of America and help the world at the same time.
President Biden discussing the plan for booster shots for Americans starting in September. The recommendation comes as the U.S. recorded more than 163,000 new COVID cases Thursday, the highest in nearly 7 months. But the pace of vaccinations is also increasing. Over 1 million doses reported administered on Friday. 60% of all eligible fully vaccinated. For more, let's bring in the Surgeon General, Dr. Vivek Murthy. Good morning to you, Doctor. Those Pfizer and Moderna booster shots will become available the week of September 20th. Walk us through what Americans should know about that and what to do.
Well, thanks, Martha. There are several things that Americans should know about the booster announcement we recently made. Number one is that the vaccines are continuing to work remarkably well for preventing people from ending up in the hospital, and they're saving lives. So that's the reason we are not recommending boosters today. But what we are seeing is a decline in the protection against mild to moderate disease. And so we are anticipating there may be an erosion in that important protection that we're seeing today down the line. And that's why, to stay ahead of this virus, we're recommending that people start to get boosters the week of September 20th. It will start with people on their 8-month anniversary following their second shot. And by necessity, that will end up prioritizing those who are at highest risk, including long-term healthcare workers, long-term care facility residents, healthcare workers, as well as the elderly.
And should individuals who got the Johnson & Johnson shot expect similar guidance soon?
Yeah, so we anticipate that people who receive J&J will likely need a booster as well. What we're waiting on right now is some data from the companies about a second dose of J&J. The FDA will then look at that data and to assess safety and efficacy, and then we'll be able to make a recommendation for people who receive J&J in terms of their boosters.
And we know that taking 3 shots is safe?
Well, this is why the plan that we announced is actually contingent on the FDA and the CDC Advisory Committee doing their full and independent evaluation. Safety is absolutely essential in this process, and we would not execute a plan if the FDA did not weigh in and say that that third shot was in fact safe. So the plan is contingent on that. But again, keep in mind this, that we have a tremendous amount of experience with these vaccines so far. They've been given to hundreds of millions of people here and around the world. The safety has held up. We'll wait for the FDA to weigh in on the third doses, and with their blessing, we will then proceed with that plan for boosters.
And Dr. Murthy, you heard President Biden address this, but the World Health Organization has asked for a temporary pause on boosters to help developing nations. The administration has said we need to do both. But can we really do that? There's a limited amount of these vaccines.
Well, Martha, we don't have a choice. We have to do both. We have to protect American lives, and we have to help vaccinate the world, because that is the only way this pandemic ends. And if we assume that the pie is fixed, so to speak, that the supply is not changing, then yes, taking more vaccines for Americans in the form of boosters will take away from the rest of the world. But our focus has been on growing the pie. It's been on increasing the supply. And that's why, in addition to donating more than 120 million doses of vaccine and moving out on the commitment of 500 million doses starting this month that the president announced earlier in the summer, we're also working with the companies and with other countries to stand up manufacturing capacity so we can really scale up production of the vaccine. We have to work on both fronts. That is the only way the pandemic will end.
And the New York Times was first to report that the FDA is trying to give full approval for the vaccine, the Pfizer vaccine, tomorrow. Is that going to happen, and what difference does that make?
Well, Martha, the FDA certainly has been evaluating the application for full approval from Pfizer. And, I won't get ahead of them, but what I will tell you is that I wouldn't be surprised if they issued that full approval soon. And the reason is because they have so much data now, and we as a world have so much experience with these vaccines. It's actually unusual for an application for full approval to be submitted with this much experience, with hundreds of millions of people having received the doses. And there are two things that we've learned during that time. One is that the vaccines are remarkably effective in keeping people out of the hospital and saving lives. And the other is that their safety profile remains remarkably strong. I anticipate if and when this does come from the FDA, the full approval, two potential things may happen. One is you may see more people coming forward, those who perhaps were on the fence about getting vaccinated, and this may tip them toward doing so. But second, I think you'll see more universities and workplaces that were considering putting in requirements for vaccines to create safer places to learn and work. You'll see more of them likely moving forward on their plans to require vaccines in the workplace and school.
And Dr. Murthy, just finally, I want to ask about kids. At the beginning of the pandemic, COVID largely didn't affect them. We're now seeing hospitalizations rise. What should we think about when we look at children going into the fall?
Well, Martha, this is really heartbreaking to see what's happening with our hospitals filling up with children. We have more kids hospitalized now than we have in earlier points in the pandemic. And, you know, as a parent of two young children who are too young to be eligible for vaccination, I really feel for parents out there whose kids are ill. And I really feel strongly that it is our moral responsibility as a society to do everything we can to protect our children. And that means that, number one, all of us getting vaccinated as adults, as adolescents, is important because kids who are too young to get vaccinated, they rely on those around them to shield them from the virus. But it's also why making sure we are taking every measure possible in schools to ensure that our kids are safe is so important. And those include masks, improving ventilation, doing regular testing, and ensuring that our children are outdoors as much as possible. So these are the steps we've got to take. We have a responsibility to protect our kids. And I can't think of anything, Martha, that's more important than that.
Nor can I. Thank you so much for joining us this morning, Dr. Murthy.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.